So what to learn today? Hi everyone, and thanks for tuning into Vhealthy Podcast. So today I'm delighted to present Dr. Soumi. She's a mental health and wellness guide with over 6 years of experience in health assessment, behavioral therapy, personal development, and holistic health management. She holds a PhD in the public health field from Bharati Dasan University, where she researched insomnia disorder and natural treatment. Scientific expertise is deeply rooted in sleep research, and she also offers evidence-based insights into improving mental and physical health through natural and practical approaches. To conclude, she's fluent in Bengali, Hindi, and English, and she blends science and tradition to help us navigate towards better sleep, mental clarity, and holistic well-being. Thanks, Dr. Soumi, to be here with us today. What motivates you to become an expert in these fields related to sleep?
So, you see, the World Health Organization and the Centers for Disease Control and Prevention, they have already highlighted the widespread nature of insufficient sleep in general population and the adverse health impacts of the same. So, even the World Health Organization have mentioned that insomnia disorder is the 11th most worldwide brain disorder, considering its global economic burden. Even the direct and indirect economic burden of insomnia disorder is much higher in untreated and underdiagnosed cases than the treated ones. So, despite the global concern, a majority of the insomnia cases remains unreported clinically because of the lack of awareness and many misconceptions related to sleep. That's why that motivated me to understand more about this physiology, which is so important and yet so much neglected.
What are your key takeaway from all your learning?
So when I was pursuing my PhD, so that time I conducted a prevalence study on insomnia, and the subject was researchers and the students. So that time I found the results when we analyzed, we found that a very considerable significant percentage of highly educated people also, they are hugely unaware of the importance of the sleep to maintain the overall well-being. More so that even the subjects who reported clinical insomnia, a very low percentage of the clinical insomniacs, they went for the clinical consultation and completed the treatment procedure.
When it comes to sleep, I hear often about circadian rhythm. I would like to have your perspective on that. Also, why do we sleep? Do we really need those 8 hours of sleep per day, as we keep hearing from many well-being advocates?
The circadian rhythm is a real thing. So we have a hormone that secretes from our pineal gland in the brain that is called melatonin. So when evening approaches, through visual cues that the sunlight is going out and the darkness is approaching, so through visual cues, our brain secretes melatonin. So when evening approaches and the night darkens, the melatonin secretion and the level of melatonin increases in our body. That hormone initiates sleep. And when we use this, the blue lights and the long night hours, exposing ourselves to the night lights, even if it is night, we're exposing ourselves to the lights, then that hormone secretion get disrupted. So it affects our body and affects our sleep cycle. Why they say 8 hours sleep? Because different stages of a human body development requires different amount of sleep, like different hours of sleep. Like for babies, it would be like 14, 17 hours of sleep for their development. So when you grow up, becomes an adult, your sleep requirement is between 7 to 9 hours. So average median number is 8 hours. That's why they say 8 hours. So it is our physiological requirement in that sleep cycle, like one night sleep cycle. There are 4 to 6 repetitive stages of non-rapid eye movement and rapid eye movement. So that kind of sleep phases are there in one sleep cycle. So those phases help in physiological and psychological healing. So that is, the sleep is very much important. And for some people, the hours of sleep vary. Some would say I need 8 hours sleep proper. Some would say I need more. So, and some would say even 6 hours of sleep are fine for me. So those who say 6 hours sleep are fine for me, they are likely having short sleep genetic condition. Like they can function better, like they can function proper on the 6 hours of sleep. So these are more extensive biological things on the genetic part. But for the general population, based on our development and the requirement of the sleep for the overall well-being, 8 hours is a median number.
We all have different body metabolism needs. How do you assess one's need and best circadian rhythm for sleep? How do you guide your patient in their quest for better health and better sleep?
It depends on the kind of health conditions you are going through. Generally, when a patient comes with sleep conditions, definitely they suffer from any kind of metabolic disorder or mental health related disorders. So, first of all, when there is already a pre existing health condition, you first need to identify that, and then you have to also understand their lifestyles, how they are functioning day-to-day basis on for the majority of the days, okay, how they are functioning day-to-day basis. And you just have to understand that what are the causal factors that is impacting their sleep. Based on that, you can guide them. If there is any behavioral change, mostly for the sleep problems, behavioral modifications can reprogram your brain in a way that you would correct your behaviors. These are all behaviors. Suppose I got used to checking phones before bedtimes and I got addicted to it. So these are all behavioral modifications. So as a therapist, I would suggest some behavioral modifications that would make them change their habit. That way, some corrections. Therapists always correct habits. So behavioral modifications is the way for the therapist. And if the condition is pretty much severe and the person is having many other chronic health conditions, then it is always advised to go to a doctor. Because if the clinical condition is in a very severe manner, some prescription drugs would be required. So when you go to a say neuropsychiatrist, that person would also give you some prescription medicines and ask you for the therapy. Both actually, because they will control the symptoms and also ask you to go to the therapy so that your behaviors also get corrected by under the supervision of a therapist. So like that manner it will proceed, and it is always recommended to complete the treatment procedure because it is a brain disorder. Specifically, it is a brain disorder. And if you're taking any medications or even a supplementary sleep aids, it is affecting your neuro-related receptors, right? So it is very much advised when you are treating any, especially going for any psychological health conditions, brain disorder related health conditions, you must complete the treatment procedure.
Talking about actually the sleeping pills versus herbal tea and the natural remedy, how both compete. Is there any wellness marketing hype towards one or the other, in your opinion?
So, see, herbal tea, powders, tinctures, these are not competitors for the prescription pills. The competitors for the prescription pills is plant phytocompound based medicines. Because the prescription pills you get, those are the synthetic medicines, means artificially lab procedure medicines. Those medicines have side effects and various kind of side effects and addiction abuse possibilities. Those medicines for specially treating for chronic insomnia, let's say, they can be used only for the short terms, like 2 weeks max, and that too under the supervision of doctor. I'm just saying whatever the literature is guiding, like 2 weeks max you can use, let's say, synthetic medicine. On the other hand, phytocompound based medicines, when they come to the market, because of their natural origin, those phytocompound based medicine would have less likely have the severe side effects. So they would reduce the severity of the side effects. For synthetic medicines are the competitors with the phytocompound based medicines. Herbal tea, powder, tinctures, those are all supplementary sleep aids. those are not competitive with the synthetic medicine or prescription pills. So herbal teas and all also, even though those are supplementary sleep aids, you are consulting a doctor, you are supposed to take those things also. If you're taking medication and then also thinking of taking herbal tea to promote sleep, you must consult with your doctor. You don't know which element is suitable for your health. Because when a doctor is diagnosing, they know if this medicine can cross react with that herbal tea component. You don't know the chemical components of the herbal tea and the medicine you are given, right? So you are supposed to consult with a doctor for that reason. So any supplement, even the natural remedies you consume, you must consult with a professional.
Currently, we live in such a fast-paced environment because of stress or achievement, performance, people saying I will sleep when I will be dead. What would you say to those people, and how crucial is sleep according to you? How does it may impact overall health?
See, when we are young, we all say these things. Okay, I remember my degree times when I was having exams and all. So we literally crushed ourselves to get the best out of us, to make the best result and everything. So those things, when you're younger, you can say those things and you have the better physical capabilities. Your body will body will survive in a way. But when you gradually your age number increases, and then you realize these things, they severely impacts body, because sleep is related with all physiological conditions. So when a person experiences chronic insomnia or even the moderate insomnia, that person is supposed to different person experience different things. Some person experience diarrhea, some person experience neuromuscular disorders, or any other disorders like chronic disorders. They experience metabolic disorders. Okay, so when you are young, these things can be said very easily, because that time you can even digest an iron. But when you grow old, you realize the importance of work-life balance and the sleep specifically, because in this time we are talking, many of us talk about antioxidants, right? The importance of antioxidants in our diet. So sleep itself is a natural antioxidant for your body. So if you are ignoring that and you are taking supplementary antioxidants in your diet, it cannot be compensated. It's not possible.
Something else you would like to share from your experience or discussion with patients?
There was a client I had who were having some dream issues. So it's not related to directly related to insomnia problem, but the person was experiencing some dream issues, and because of that, his sleep was getting disrupted. So I thoroughly listened him, and I also asked him, like, what could be the reason behind, like, I did a little bit of retrospective study, a conversation with him. So then I talked with him, and we did like retrospective background check. And then, like, within 2 weeks, like less than 2 weeks actually, he texted me like, my dream issue got resolved. So I was so happy to hear, because it's all behavioral. Like, everything you are experiencing in life is related to something, some conversation, some habits, the way you choose to formulate any information. So it is, a lot of things can be achieved. A lot of health complications or thinking complication can be resolved through behavioral therapy. If you have to just sit and have a very thorough conversation with the person and figure out the causal factor, and reasonably make the person understand why this is happening with you. So this is very important.
It helps to have a different perspective that we may not find ourselves trying to solve everything on our own.
So that's where the therapists are important, so they professionally are there for you to listen you and to ask you the right questions to make the person reasonably understand any complication, to simplify any complication, mental complication. Behavioral therapy is very important. I strive to help my clients with thorough understanding of their health condition and to guide them with my evidence-based approach, including behavioral therapy.
Thank you so much again, Dr. Soumi. Anyone can book a session with you on Vhealthy.
So I'm looking forward to it.